Hello and welcome back to my channel. Today we're going to talk about mononucleosis, often referred to as mono. This condition is common, especially among teenagers and young adults, and it can have a significant impact on your health and daily life. We'll explore what mono is, how it's diagnosed, and how it can be managed effectively. Hi, I'm Dr. Knapp, family medicine physician, here to bring you medical information so you can take control of your health and make the most of your doctor visits. Let's get started. Mononucleosis is an infectious disease usually caused by Epstein Barr Virus, or EBV, which is a member of the herpes virus family. Once infected with EBV, the virus remains in your body for life. It's most commonly transmitted through saliva, which is why it's often called the kissing disease. However, it can also spread through other means, such as sharing drinks, utensils, or through coughing and sneezing. The symptoms of mono can vary, but typically includes extreme fatigue, fever, sore throat, and swollen lymph nodes, particularly in the neck and armpits. Other common symptoms are a swollen spleen, liver inflammation, and a skin rash. The incubation period, or the time from exposure to the virus until symptoms appear, is usually 4 to 6 weeks. The symptoms can last for several weeks, and in some cases, fatigue can persist for months. Diagnosing mono usually starts with a clinical evaluation based on symptoms. If mono is suspected, your doctor may perform a physical examination to check for signs such as swollen lymph nodes, tonsils, liver, and spleen. Additionally, they may recommend a series of blood tests. The most common blood test for diagnosing mono is the monospot test, which detects antibodies that form in response to the Epstein Barr virus. This test is generally accurate, but it might not detect the infection during the first weeks of symptoms. If the monospot test is negative, but mono is still suspected, your doctor may order more specific EBV antibody tests. These tests can differentiate between current, recent, or past infection. While mono is usually not serious, it can lead to complications, especially if not managed properly. One of the most concerning complications is an enlarged spleen. If the spleen ruptures, it can cause severe abdominal pain and requires immediate medical attention. Liver inflammation, or hepatitis, is another potential complication, leading to jaundice, which is the yellowing of the skin and eyes. Other complications include anemia, which is a reduction in the red blood cells, thrombocytopenia, a decrease in blood platelets, and issues with the nervous system, such as meningitis or encephalitis. These complications are rare, but highlights the importance of proper management and monitoring of the condition. Managing mono primarily involves supportive care, as there is no specific antiviral treatment for Epstein Barr virus. Rest is crucial to help your body fight the infection. Most people with mono will need to take time off from school, work, and other activities to recover fully. Staying hydrated is essential. Drink plenty of fluids such as water, herbal teas, and clear broth to prevent dehydration, especially if you have a fever. Over-the-counter pain relievers such as acetaminophen or ibuprofen can help manage symptoms like fever and sore throat. However, it's important to avoid aspirin, particularly in children and teenagers, due to the risk of Ray's syndrome, a rare but serious condition. To relieve a sore throat, you can try gargling with salt water, sucking on a lozenge, or using throat sprays. Ibuprofen is also good for throat pain. Eating soft, soothing foods like soups, smoothies, and mashed potatoes can also make swallowing easier. Avoiding irritants like cigarette smoke and alcohol can help prevent further throat irritation and liver strain. Since an enlarged spleen is a common complication of mono, it's important to avoid activities that could cause abdominal trauma. This includes contact sports, heavy lifting, and any strenuous activity. Your doctor will typically advise you on how long you need to avoid these activities, which can range from a few weeks to several months, depending on the severity of the spleen enlargement. Regular follow-up appointments with your doctor are important to monitor your recovery and manage any complications. They may perform periodic physical exams and blood tests to ensure your liver and spleen are healing properly. If symptoms persist or worsen, your doctor might investigate other potential causes or complications. In some cases, corticosteroids may be prescribed to reduce severe throat swelling or tonsillitis that obstructs breathing. These medications can help reduce inflammation, but are generally used only in specific situations due to their side effects. I just want to take a moment to ask that you hit that like button, subscribe to my channel, and leave a comment below if you have any topics you want covered in future videos. Anyway, preventing the spread of mono involves practicing good hygiene. Since the virus is spread through saliva, avoid sharing drinks, food, utensils, and personal items with others. Cover your mouth and nose when you cough or sneeze, and wash your hands frequently. If you have mono, try to avoid close contact with others, such as kissing or close personal interactions, until your symptoms have fully resolved. Mono can be a challenging condition, but with proper care and management, most people recover fully without long-term issues. It's important to listen to your body and give yourself the time and rest needed to heal. If you have any concerns or questions about mono, don't hesitate to reach out to your doctor for guidance and support. Thank you for watching. As always, take care of yourself and make the most of your day.